Hi there, this is Cassie Cannon of Cannon Psychology, and today I wanted to talk to you about phase 1 of the 8 phases of EMDR. So phase 1 is essentially history taking and treatment planning, which is exactly the same thing that you would do with any other psychologist, no matter what modality they're doing. So it's essential for me to know your past history, what things were like growing up, what things are like now, any past symptoms or current symptoms of depression, anxiety, trauma, PTSD, and anything else that you feel like is relevant. So for me, history taking, depending on the person, can take between 2 and 4 sessions. Usually it takes me about 2 sessions, but if you're somebody who likes to give a lot of details, then I'm going to just listen to you and take it all in. And as you are talking to me about your history, I'm also treatment planning in my head. So I'm jotting down ideas of what we need to do and where we need to go. I am also specifically looking for the symptoms that are bothering you now and what you hope to get out of treatment with me. So once I have a thorough history, I may or may not diagnose you with something based on if you meet criteria for diagnoses, but I will absolutely give you an idea of symptom clusters at the very least of what's going on with you. And then you and I really decide together where you want to go and what you want to do first. And I typically like to tackle the problems that are bothering you the most. And oftentimes what I found is when we tackle the biggest problem, what happens is a lot of the healing starts to generalize to the other problems that are going on in your life. And so then we reevaluate where to go next once your symptoms have decreased. And in some cases, symptoms can completely go away. So it just kind of depends on what we're working on. So once you and I do a full history, then you and I create a treatment plan together. I actually write it up and give you a copy, and we identify exactly where we're going to go and what success looks like for you. When it comes to treatment planning with EMDR, I have found that one of the ideal ways to go is to address the past trauma that is driving the current symptoms. And so we typically do the past stuff, and then we look at the present triggers that are bringing up the past stuff, and then also preparing you for the future in situations that you might feel triggered by doing something called a future template. So we do past triggers, present triggers, and then we prepare you for the future. So that is phase 1. We are doing history and treatment planning. I like to update the treatment plan every 6 weeks, 2 months or so. And you and I actually look at where we have gone, what we're doing now, and we always rediscuss, are we going the right direction that you like? Is it time for us to switch directions? Just a great way for you to know where we're going and if we're on track or not. So that is phase 1.